A wheelchair helps individuals remain mobile when they can't walk or have difficulty walking due to illness or disability. Some patients who come to the medical office in a wheelchair are able to transfer themselves from a wheelchair to an examining table. However, others may need assistance. The medical assistant plays an important role in the transfer of a patient safely and efficiently from a wheelchair to an examining table and back again. Obtain a transfer belt before you begin. The belt provides a secure grip and helps you control the patient's movements. Sanitize your hands. Greet the patient and introduce yourself. Identify the patient and explain the procedure. Determine whether the patient has the mental and physical capability to perform the transfer. Estimate how heavy the patient is and whether the patient can provide assistance. Assess whether or not you are able to perform the transfer safely. Do not perform the transfer if you think you may incur a musculoskeletal injury. Factors which would prevent you from making the transfer include patients who are overweight or patients with conditions that limit their mobility, such as leg paralysis. Ask for assistance or notify the physician if the patient cannot be safely transferred from the wheelchair. Wrap the transfer belt snugly around the waist over the patient's clothing. The clothing protects the skin from abrasions. Fasten the buckle in front by threading it through the teeth and the two openings to lock it. There should be just enough space for you to comfortably insert your fingers between the belt and the waist. If it is too loose, the belt may slide up the patient. With the patient's stronger side next to the examining table, position the wheelchair at a 45-degree angle to the end of the examining table. If the table is height adjustable, adjust it to the same height as the wheelchair or slightly lower. If the table is not height adjustable, such as the one you see here, pull out the table's footrest. Lock the brakes of the wheelchair to prevent it from moving during transfer. And fold back the footrests to clear the path for making the transfer. Make sure the patient's feet are positioned flat on the floor. Tell the patient what to do during the transfer. Stand in front of the patient with your feet about 6 to 8 inches apart with one slightly forward. Point the toes outward and bend the knees slightly. This position provides a wide base of support for the transfer. Ask the patient to place her arms on the armrests of the wheelchair and to lean forward. Grasp the transfer belt on each side of the patient's waist using an underhand grasp. The transfer belt provides a secure handle for holding onto the patient and controlling the patient's movements. Tighten your abdominal and gluteal muscles in preparation for the transfer. Instruct the patient to push off the armrests and into a standing position on the count of 3. Straighten your knees and assist the patient to a standing position by pulling upward on the transfer belt. Make sure to keep your back straight and lift with your knees, arms, and legs, and not your back. Pivot and position the patient's buttocks and back of the legs towards the examining table. Instruct the patient to step backwards onto the footrest 1 foot at a time. Gradually lower the patient into a sitting position so that the buttocks and thighs are firmly supported on the table. Remove the transfer belt. Unlock the wheelchair and move it out of the way. Push in the footrest of the examining table. Stay with the patient to prevent falls. When the patient is ready to return to the wheelchair, put the transfer belt back on. Position the wheelchair at a 45-degree angle to the end of the examining table. If the table is height adjustable, adjust it to the same height as the wheelchair or slightly lower. If the table is not height adjustable, such as the one you see here, pull out the table's footrest. Lock the wheelchair and fold back the footrests if needed. Inform the patient about what to do during the transfer. Ask the patient to place her arms on your shoulders, but not around your neck, as this could cause an injury. Stand in front of the patient with your feet apart, one slightly in front of the other and knees bent. Grasp the transfer belt on either side of the patient's waist using an underhand grasp and instruct the patient to stand on the count of 3, using the muscles in her legs and thighs. Straighten your knees and assist the patient to stand by pulling upwards on the transfer belt. Instruct the patient to step down from the footrest, 1 foot at a time. Pivot the patient until the back of the legs are against the seat of the wheelchair. Bend your knees and gradually lower the patient into the wheelchair with the buttocks at the back of the chair. Remove the transfer belt and make sure the patient is comfortable. Reposition the footrests and help the patient place their feet on the footrests and unlock the wheelchair. Push in the footrest of the examining table. Wheelchair transfer is not usually charted. However, please note any significant findings such as weakness or unsteadiness.